If we don't step up, figure out how to develop leaders, keep them in place, develop leaders behind them, and make positive changes so that we can demonstrate our industry isn't just there for people to fall in the door when they're sick on an episodic basis, but actually be able to afford to take care of them in a better way over time. But if you don't invest in that leadership, you won't be successful.
Mark Wagar, president of Heritage Medical Systems, led the keynote address at the 5th Annual Accountable Care Organization Summit in Washington, D.C. on June 20th. Sponsored by Heritage Provider Network, the Engelberg Center for Healthcare Reform at Brookings, and the Dartmouth Institute for Health Policy and Practice, Wagar discussed clinical leadership in ACOs and the numerous ways HPN's strategy of care and population management has been successfully implemented, passing along considerable savings to its members.
There were 29 pioneer ACOs in the country. About a dozen produced some savings. There were 2 that produced 42% of all the savings in the country, and 1 was Heritage. And it is these characteristics I'm talking about and the history of developing physician leadership as a core principle in our business that has been one of the keys.
HPN has from the start come into the delivery of healthcare with a focus on several things that I think are critical for the success of accountable care generally. First and foremost is a culture that puts the patient first. So clinical leadership and a whole model, for a whole mindset for delivering care that's around asking and answering the question, how can we do this as effectively as possible? How can we do the most to get our patients healthy at the lowest cost?
Over 450 healthcare leaders attended the ACO Summit, an innovative forum exploring ACO's related delivery systems and payment reform.
We partnered through our Merkin initiative with the Khan Academy, which is an online math tutorial program. Tens of millions of people have used it nationwide and worldwide, and we've created a health policy curriculum for them.
Heritage Provider Network's ACO program has been successful because it is physician-led, it is physician-based, it embraces innovation. It is not something that wants to make small iterative changes. It wants to make disruptive changes so that the families of America can all afford health care.